Good afternoon. I'm Adrian Dix, BC's Minister of Health. Beside me to my right, Dr. Bonnie Henry, our Provincial Health Officer. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and Esquimalt First Nations. Just to let you know some scheduling for next week. We'll be briefing here on Monday at 1:30 p.m. Monday, and then from Tuesday to Friday at 3 p.m. just so you can plan for that. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. For today, we'll give an update on the number of new cases. Also, a little bit of a change in some of the data and how we're getting it, given the changing situation that we've had in BC, and also, as you saw yesterday, our plan for how we're scaling up the response in the different hospitals around the province. Our number of new cases that are test positive today in the last 24 hours is 92, which brings us to a total of 884 test positive cases here in British Columbia. That includes 444 in the Vancouver Coastal Health Region, 291 in Fraser Health, 60 on Vancouver Island, 77 cases in the interior, and 12 now in the Northern Health Region. In addition, we're up to 12 long-term care homes that have had at least one resident or staff test positive for this virus, and that's 6 in the Vancouver Coastal Health Region and 6 in the Fraser Health Region. And as we know, whenever we have even a single case in a long-term care home, the full outbreak protocol is being implemented in those homes across both, mostly in the Lower Mainland, as we know. So in terms of people in hospital, we have 81 now who are hospitalized in the province, and the new numbers that we have are helping us get a better understanding of hospitalizations, and it really is more of how we're collecting the data, so both for hospitalizations and for ICU. And as of today, we have 52 people who are in ICU with COVID-19 across the province. We also have one additional death in the Vancouver Coastal Health Region. On a positive note, we now have 45% of our cases have fully recovered, and that includes 396 people who have had COVID-19 who are now recovered. Want to talk just a little bit about some of our response efforts, and I know I get a lot of people who are saying we should have a lockdown as they're doing in some other places, and we have talked a number of times about how we're doing things here in British Columbia, and really we've done very similar to what others are calling a lockdown. We have done it in a more strategic way, or we've tried to do it in a very thoughtful and purposeful way, rather than having blanket restrictions on certain things. And one of the ways we, for example, how we closed the in-classroom schooling, but really the importance of being able to support both essential workers like healthcare workers and grocery store workers and others to be able to continue our essential services. We need to have the ability to care for children, and that is what the Ministry of Education and our school districts are working on. In addition, it's important for us to make sure that we have those supports in place for the children who are most disadvantaged by the closing of the physical classrooms. And so that is also something that the ministries are working on very thoughtfully in our province to make sure that we can best support those who are going to have the most challenge in terms of bouncing back from an extended closure. We also, the purpose of what we've been doing is to try and reduce the exposure for those who are at highest risk, and to impose those physical distancing in all of the places that we can to try and minimize the transmission of this virus across the province, as you've heard me say again and again. And really, we have seen in our communities extraordinary community goodwill and compassion and care. And, that is what will get us through these next few weeks. Our cases are continuing to increase. We know that. We know that people who have been exposed in the last 2 weeks are continuing to get sick. And these measures that we are doing now are designed to try and prevent those transmissions from those people to the next generation. But any severe outbreak or cluster of cases is going to tip the scales for us. And we are at that very critical point right now where we need to continue this action together. We must stay apart with our physical distancing. We must stay home if we're ill. We must be united in this and 100% committed until we flatten this curve for good. Now more than ever, we need you to keep this up. And I just want to also say that, we do appreciate everything that everybody is doing right now, and that is what is going to keep us going for these next few weeks.
Thank you very much, Dr. Henry, and I wanted to just provide some other health information numbers and systems numbers from across the system as well. As Dr. Henry has said, we now have 884 cases. That's an increase of 92 over yesterday. 396 recovered cases, which is an increase of 121, and 81 cases in hospital. And just with respect to the hospital numbers, that's 31 cases in Vancouver Coastal Health, 39 cases in Fraser Health, 6 cases in Interior Health, 3 cases in Island Health, and 2 cases in the Northern Health Authority. There's interest in the number of hospital beds available. Today, the total vacant beds across the healthcare system is 4,295, which continues the work that we described yesterday to prepare the healthcare system for what we expect to be more cases in the coming weeks. As well, there's, I think, significant interest in the number of people re-registering in the healthcare system. We now have 28 new registrants as of yesterday amongst doctors, 309 in nursing that include registered nurses, licensed practical nurses, registered psychiatric nurses, nurse practitioners, and healthcare assistants. We also have a significant re-registering in allied health, and we thank all of those who've re-registered for their commitment. I also want to point out that we have significant increases in the number of responses in our ambulance service to influenza-like illnesses, and while overall calls to the ambulance service are down, I just want to acknowledge the extraordinary work of the ambulance paramedics of BC, of QP Local 873 across BC, which has, I think, been extraordinary. Finally, I want to acknowledge last night in Interior Health the work of the opposition health critic Norm Letnick, who hosted an event last night with Susan Brown, the president of the Interior Health Authority, of Dr. Sue Pollack of Interior Health, who did an event last night which shows, I think, our joint commitment to the work that we need to do together. Finally, I have to say that, again, we have to be 100% all in the work that we do together. That we've shown, I think, and are showing an ability to bend the curve in BC, but that ability depends on all of us every day recommitting to the work that we do together every day to improve, to ensure and to stop the spread of the virus in British Columbia. Are you thinking of going out and doing something other than essential work or errands or exercise? Don't. Stay home. Stop the spread. Bend the curve. As Dr. Henry has said, we're moving to a virtual world. Use that virtual world to connect with your loved ones, of course. Do that more. To support seniors and elders, do that more. But stay home as much as possible. Stop the spread and bend that curve. By working apart, we're standing together. The distance between us, we've said, unites us. So I'm going to repeat, 100% commitment, 100% of us, 100% of the time. We all have to dig deeper, fight harder. We must continue to be 100% all in. Nous annonçons aujourd'hui 92 nouveaux cas de COVID-19 en Colombie-Britannique, pour un total de 884 cas en Colombie-Britannique. Chaque régie de santé de la Colombie-Britannique compte des patients atteints de COVID-19. 444 se trouvent à Vancouver Coastal, 291 à Fraser, 60 sur l'île de Vancouver, 77 dans l'intérieur et 12 au nord. Nous sommes attristés de signaler un autre décès à la suite de COVID-19 dans la régie de santé de Vancouver Coastal pour un total de 17 décès liés au COVID-19 à ce jour. Nous offrons nos condoléances à leurs proches pendant la période difficile. Un nouveau établissement de soins de longue durée dans la régie de santé de Fraser a confirmé un cas de COVID-19 aujourd'hui pour un total de 12 foyers dans la régie de santé de Vancouver Coastal et Fraser. Les responsables de la santé publique soutiennent l'implémentation des protocoles d'épidémie. Sur le total des cas de COVID-19, 81 personnes sont actuellement hospitalisées dans le système de santé en Colombie-Britannique. Nous avons ordonné aux citoyens de rester à la maison s'ils ont voyagé ou sont malades. Nous demandons aussi à rester à l'écart en prenant des distances physiques. Nous avons vu d'innombrables exemples de bonne volonté communautaire, soutenir les personnes isolées, faire les courses pour ses voisins et se connecter avec soin et compassion. Nous apprécions beaucoup cela. Nous devons être unis et nous engager à 100% et faire tout notre possible pour aplatir la courbe. Merci de contribuer à faire une différence et ne vous arrêtez pas. 100% est nécessaire et il va falloir que tout le monde le fasse à fond dans les semaines à venir. We're happy to take your questions.
Okay, for all the callers on the phone line, please remember to press *1 to enter the queue. You are limited to one question, and unmute your phones, please. You will not be audible until we call your name. First question comes from Joel Ballard at CBC. Go ahead, Joel.
Hello, this is Joel Ballard from CBC Vancouver.
Go ahead.
My question is for Dr. Henry. Is the province offering any anti-malarial treatment to vulnerable COVID patients in care homes? We're hearing a lot of rumors about that going around across BC, and is there any truth to it?
So as I know many people are aware, hydroxychloroquine is one of the medications that is experimental, that has been used in China in some cases, and there's a number of others as well. Remdesivir, which is an anti-HIV drug, that is also an antiviral drug, which has also been in clinical trials. So there has been some experimental use of hydroxychloroquine and remdesivir, all within the protocols of the international trials that we in Canada are part of. So we do have a research group based at mostly UBC and BC CDC that we've been collecting together around the province, and part of that is participating in some of the international trials. So it has been used under the experimental protocol in one facility that I'm aware of, but we know our critical care physicians are watching the data, of course, that's going on around the world, and are being part of the clinical trials as they get started around the world as well. So there will be more use of all of the potential therapeutics.
Next question comes from Glenda Looms, the province. Go ahead.
Hi, thank you. Yesterday when you released some of the projections, you said we could be on a trajectory to see possibly 2,000 to 3,000 deaths. Does this just tell us when the peak will hit at all, or when the rate of decline will begin? Is there any status that shows us when that peak will be?
So a couple of things. One, those were not projections. Those were models that helped us understand where we were and how things were evolving in our outbreak compared to others. And so there was no way that we were projecting 2,000 deaths. I'm not sure where that came from, but that was not part of what we presented yesterday, and I think we need to be very cautious about that for a couple of reasons. One is, we have had about 2% of the cases that we know of in BC, we've had deaths, but they've been mostly located in our long-term care homes, and we know people in long-term care are older, have underlying illnesses, and are more likely to succumb to COVID-19. So in no way were what we presented yesterday meant to suggest that we would have, project the number of deaths we're going to see. Everything that we're doing is to ensure that people get the care that they need, and so that we can prevent as much severe illness and, of course, try to manage people through this. So in terms of the peak, as I said yesterday, we don't know the peak until we're looking back at it. So none of this is able to let us know if we've reached the peak or not. We need to continue to monitor and follow everything on a daily basis to see if we are flattening that curve. But really the only way to tell is in retrospect where the peak is. If we start seeing decreases, consistently decreasing number of new cases per day, everything else being equal, that usually tells us. And right now, of course, they're looking in places like Italy to see if they're in that place. But it is very challenging to know when the peak is. And the models that we presented yesterday are not about predicting the peak or predicting the future. They're about helping us plan for what we need to do and how and helping us understand the trajectory that we're on right now.
Just to say that the models we presented yesterday, as Dr. Henry said, reflect our absolute determination to prepare for the worst possible scenarios, and that's what you saw yesterday. And so you saw a comparison against what we've seen in South Korea, against Hubei province, and two projections with respect to Italy. But again, those preparations will continue. It's why we have more than 4,000 empty hospital beds that are in acute care that are available for use in British Columbia. It's why we've done that, because we are preparing absolutely for those circumstances. Every emergency operations center in every health authority is preparing absolutely. But what we need, and what those models should tell the British Columbians, is the absolute need for us to be 100% all in as a community, following the orders of Dr. Henry. And we have to continue to do that every day. Every day is important. Every hour of every day is important. Every decision that every person makes is important in order to take steps to bend that curve. Because we have to, of course, prepare for the worst. Not because we think the worst will happen, but because we have to be prepared for it in our acute care system. We have to be there for our doctors and our nurses and our healthcare workers. So what that should say to everybody out there, is we need 100% commitment every day. That's what we need as a community to do, because that's what our healthcare system is preparing to do as well.
Les Lane.
Well, thanks. Doctor, I understood yesterday when you said the 2,000 or 3,000 figure was the modeling of cases, not fatalities, obviously. I just wanted to get some context on that. I noticed virologists elsewhere, like in Italy, are saying, making similar estimates. But one thing I'm not clear on is how that model would produce that estimate on the suggested rate you mentioned of 130 cases per million. Could you maybe explain that and put that, I guess it's a guess or a model of the actual count as opposed to positive returns in some context?
Sure. And yes, it is a guess. And it's a guess based on what we've seen in other places, looking at a number of different things. So what the modelers try and do is sort of triangulate. And in some places, if we look at Wuhan, for example, they estimated for every death there was X number of cases in the community. It's challenging for us to do that because, as I've mentioned, most of our deaths have been clustered in long-term care. So you can consider the cluster in long-term care as one event, for example, and determine how many people you would expect to see positive in the community given that event. The other markers we use are hospitalization. So how many people get sick versus how many people are in hospital. And again, it comes from data from other countries where they've said that, X number of people have milder illness or undetectable illness, and X number of people, in relative number of people, end up in hospital or in ICU. So those are also ways of estimating how many true cases there might be out there as opposed to those who've been tested and test positive. So they've used, the modelers at BC CDC have been talking to their counterparts across the country and around the world, actually. There's a lot of really good exchange of scientific information. So yes, the estimates that I presented yesterday of somewhere between 2,000 to 3,000 people being infected with this in BC are based on that type of triangulation. And as we said, it is, and you're correct, it's not deaths. It was numbers of true cases that might be out there, given that we can't and are not testing everybody. So that's based on some of the modeling guesses and based on what we've seen in other countries.
Next question, Mike Hager, Globe and Mail.
Hi, you two. Thanks again for the briefing. I wanted Minister Dix's answer to the call from the provincial seniors advocate. I just talked to her, Ms. McKenzie. She said that already from the outbreak at nursing homes across the province, it's clear that workers at these homes are in too precarious a position, hence, working at multiple facilities. She said after this pandemic is beat, there will have to be a reassessment of the precariousness of that workforce in the sector. Are you committing to reviewing that and reforming how the labor is organized in our nursing homes?
I will turn it over to Minister Dix. I will tell you that that was one of the really important considerations that I took into account with, we took into account with the order that I gave out earlier last week. And we've been working with all of the unions, with the Health Employers Association of BC, with my office to ensure that we can put in place a rational and reasonable ability for people across the sector in long-term care to work only at one facility. And as we've talked about before, part of the issues were subcontracting out and private contractors who had people working at multiple places. So right now for the pandemic, we are taking a really important initiative across the province to ensure that people are able to work only at one facility, and that that is supported across the board, and that we get rid of some of those issues that have been plaguing that sector. But I'll leave the details to you.
Okay. To say absolutely, the work that we're doing in long-term care, the work of medical health officers in all of our health authorities, the work of unions in long-term care, the work that we're doing with BC care providers in denominational health, all points in that direction. We have to continue to do the work we're doing to make to give value to the work of all of the workers in long-term care. So I agree with that there are lessons to be learned and lessons that are going to be learned. And this is some of the work that we've been doing in the last number of years with employers and with unions alike. And I think, for example, the work we did to get rid of Bill 2994 is part of that, but it's work that we have to all do together to make sure that our workers are safe, that the work is not precarious, and that it's valued as it should be in our society. I think that we didn't need this pandemic to know that the work done by workers in long-term care is some of the most valuable work done by anybody in BC. I believe that with passion. I think people in the system believe that with passion, and we're going to continue to do that work. The important thing now is that we follow the orders of the provincial health officer, that we follow the orders of medical health officers, and we support the workers in long-term care, because I can't imagine more important work in society. It's something that we've worked on together for a long time, and we're going to have to continue to do more work on. Another example of that, of course, is home care and home support and the work we've done to bring that work in that case under health authorities. The long-term care sector is a little different than that, but we're going to work together with all our partners to ensure that workers are safe, that the quality of care is high. That's the work we've been doing together for a couple of years, and it's the work, and if anything we've learned from this pandemic, it's that we have to continue to do that work together in the coming days and weeks and months and years.
Next question, Keith Baldry.
Hi. Question about the ICU numbers. They seem to be up quite a bit, but I understand you've changed the measuring or definition of that. Can you explain what that is?
So it's been a challenge as more people are going into ICUs, and as you know, we have 17 facilities that are our primary COVID facilities to start with. So actually understanding who's in an ICU on a day-to-day basis is not a simple thing. Understanding who's in hospital is a little bit easier, but people go from a hospital bed to an intensive care bed. They may be put on a ventilator. They may come off the ventilator. They may go back into a hospital bed. So we've been trying to consolidate exactly, at one point in time in a day. So the numbers we present, of course, are at one point in time that represent the 24 hours before that. So we're consolidating that information in a much more timely way, and that's been work that's been done provincially at the Provincial Health Services Authority. The other thing that we talked about a little bit yesterday in terms of why we used 80% people requiring ventilation is because our critical care teams have been talking to their colleagues around the world and been, as we have more experience with treating people with COVID-19, they've recognized that putting people on a ventilator early protects healthcare workers because you don't have to do an emergency intubation, putting the tube, a breathing tube down into somebody's throat, but it also makes people, helps people recover from the virus faster. So if you support their breathing earlier, it means that they often stay in hospital less time and they have a better chance of recovery. So that is something that the critical care physicians have been implementing across BC. And as more people have been entering hospital, we are seeing an increase in people going into ICU and being put on a ventilator sooner rather than later, because that seems to improve the outcomes. So that's one of the reasons the numbers have gone up quite quickly in the last few days.
Mary Griffin, Check News.
Oh, hi. Thanks so much, Dr. Henry and Minister. Just a question, a two-part from a viewer. Wanted to know about BC's numbers for recovered are substantially higher than in Ontario, for example. Ontario, they base their recovery on 2 negative tests, and I'm just wondering, is there a different criteria in BC because we have so many more recovered? And then I'm just wondering about this paper from the Journal of American Medical Association about convalescent plasma, and because it's been used in other outbreaks, including SARS and Ebola, and your thoughts on that as a potential future treatment.
Absolutely. Yes. So our recovery rate is quite high for a couple of reasons. One is we started getting more cases earlier on because we had these outbreaks in long-term care, and many of the people affected were young, healthy healthcare workers. So they had milder disease that didn't last as long. And yes, we did change our criteria. I think I talked about this, but nationally we've agreed that there's criteria for when people can be considered recovered after having mild disease in particular. And so for people who have not been hospitalized, who have mild disease, we are now considering them recovered when they are symptom-free, their symptoms have resolved, they no longer have a fever, and it has been 10 days since their symptoms. So that is the reason why we've been able to clear a lot of people who've been perfectly healthy for a while without having to have the 2 negative lab tests. And so that has been validated around the world. It's been because of data that we've seen, particularly from Germany, which shows that after a period of time when your symptoms resolve, you no longer shed live virus. So the test can still be positive for a period of time because the test detects the RNA of the virus, but that RNA just it may be a symptom of a virus that is no longer alive in the system, and you shed it for a period of time in your saliva, in your blood. Not in your blood, sorry, in your saliva and sometimes in your stool and other things. So we have no longer have the criteria for two negative tests 24 hours apart for people with mild illness who are not hospitalized. We still use that criteria for people who have more severe illness or who are in hospital or in ICU, or people who are immune compromised, because we know they can shed live virus for longer. So that is one of the reasons. So, and I don't know, I know Ontario is looking at as well applying those criteria. In terms of convalescent sera, that's something that we look at every time there's a new virus or a new disease, and it basically is if you've recovered from the disease and your body has developed antibodies, can we take those antibodies from your blood and give them to somebody who is fighting the disease early on, and see if that helps treat it and helps them basically supplement their own immune system response so that the virus doesn't take off in their body. And that's something that they've been looking at in China. It has not had a lot of success yet, and it's a tricky thing because it takes some time to build up antibodies in your blood. And then it has to be purified. So you have to take blood from people, you have to purify the antibody and develop it into an immune globulin, we call it, that is then given to other people. So as you can imagine, it's not a large volume that you can get from every individual, but there are clinical trials looking at that, looking at whether it provides benefit or not. There was trials done during SARS, because this is one of the very basic things that we always try and look at. And it was not particularly effective during the SARS outbreak. But then, there wasn't as huge numbers of people infected as we're seeing here. So I know there are trials ongoing. I don't know if I know we're involved in them, but I don't believe anybody has been donating their plasma yet here in BC, because we're still early on in our curve here. I do want to say, though, that there's other things that we are doing in the ICU to try and support people, in the hospitals to support people, and I can't underestimate the importance of all of the care team and the work that they're doing, not only to this early ventilation of people, experimental treatments, but the importance of nutrition and the work that the nutritionists are doing in our hospitals as well to support people and help their body maintain their immune system and recover. So those are really critical things that I want to put a shout out to them too.
And just to take the opportunity, I saw one of my colleagues, Ravi Kalan, giving blood this week to give for those people who are able to do that, who are following provincial health officers' orders, of course, and recommendations, but who can give blood safely, to please do so. We want to put out another call for that today, because it's such a critical thing to do in a healthcare system at any time, but particularly at this time.
Next question, Nelson Bennett, Business in Vancouver.
Yes, Dr. Henry. So over the last few days, when you look at the daily increases from the previous day, for about a week, it seemed to be, suggesting that it was starting to flatten or reach an inflection point, but today's numbers seems to blow that out of the water. I think this is the highest daily increase in more than a week, possibly since the start of the outbreak. Is that a bit depressing, or were you expecting this because of all the additional testing that's being done?
Well, it's not unexpected, given where we are in the outbreak and the fact that we're continuing to have seeding of long-term care homes. We're continuing to do, as you say, a high volume of tests, and we're targeting the testing on people that are more likely to have the disease. So that's part of the trade-off. I will say, it is absolutely the highest one-day number that we've had. But as a percentage, it still is less. So we're not seeing the percentage increase climbed dramatically. It's a 92 over 884. It's a little over 10%. Yesterday was about 8%. So looking at the rate of change is something that we're also following. So it's not unexpected. It just reminds us that we're in the midst of this right now, and everything that we do is really important to try and keep it at that lower rate, to try and keep that inflection and try and do the best we can to prevent transmission everywhere in our communities now.
Next question, Allison at CTV. Go ahead.
We've heard reports today from Quebec that they are stationing police officers at the border to inform people coming back that there is the mandatory 14-day self-isolation coming back from the US. Are there plans to do that here in BC?
Not that I'm aware of. I know Quebec has been doing that at the airport in Montreal as well. We are relying on our federal counterparts, and we've been working very closely with them around these issues. And I know there have been a number of people who have been stopped at the border, our land border in particular, and have been put in quarantine in the last few days. And so and we've been in contact with the quarantine service as well as CBSA around those issues. So I'm heartened that that is happening and that it is working, I think. We've always been trying to ensure that there are strong messages at all of our borders. And as you know, YVR is still one of the airports that international flights are being directed to. So we've been monitoring very carefully there to make sure that the right messages are getting to everybody as they come in through YVR as well.
Ross Crockford, go ahead.
Hi, this is for either Dr. Henry or the minister, whoever can better answer. I'm curious about the testing of the general public to find the so-called asymptomatic carriers. And I know BC is carrying out a lot of tests today, and mainly on people who are in the healthcare system. But just how much testing of the general public is going on, and when can we expect to see that? Or if it's not happening, why isn't it happening?
Yeah, so at the phase we are in right now, we are not testing asymptomatic people anywhere. I shouldn't say that. There are some occasions where we're testing asymptomatic people. For example, if you were a very close contact in the room in a long-term care home, for example, then testing can be really important because it will change our management of that individual and what we're going to be doing. We also have tested people without symptoms when we're trying to find a source for an infection, and we've done that from the very beginning. But at this point in our epidemic, the important thing is identifying those chains of transmission and where people are getting sick. And so that's why the focus is on the healthcare system, on healthcare workers, but also community transmission. So there is some testing of people if there's clusters being identified in communities, and this is happening around the province. And so people are being tested if they've been exposed, and we're unclear about whether they have symptoms or not. But a broad testing of well people in our community right now is not what we're going to be doing. That is a strategy that we will be looking at if and when we come to the downside of our curve, when we're looking again at introductions coming into BC from other places. And that's a part of the strategy that would be at that phase of the epidemic, but certainly not right now.
Brenna Owens, Canadian Press.
Hi there. So just based on what we learned yesterday, I'm just wondering if one of you could elaborate on what exactly is happening in terms of resources for Northern Health. I just saw a note that in Bella Coola, for example, there are some folks who are coming from other parts of Western Canada to kind of like their summer properties, I guess. And that community, I've heard, only has one ventilator. And so just wondering if you could kind of give a bit of an overview of what's happening in terms of directing resources there.
Yeah, so I know it's been a challenging thing across the north and for more remote communities here on Vancouver Island, in the interior as well. And the challenge is, of course, that we we are not always able to keep everything out because there's essential services that need to happen. In terms of the health sector, part of the strategies, and you saw the modeling yesterday, revealed that there are critical areas where we need to supplement resources. And so ventilators are being prepositioned in areas where they can be used. But also, I think, very importantly for the North is the strategies to ensure that we can get more rapid testing for them, as well as the transportation systems, so that if we identify people, there's an effective place to put them if they need hospital care, and that may mean removing them from the community and taking them to a place where they can receive the care they need. And so that is a strategy that's being worked on, as well as within many of the communities having a strategy or a plan in place to isolate people effectively. And we know that that's work that's going on with the First Nations Health Authority and First Nations communities as well, to make sure that if somebody becomes ill in a crowded situation, they're able to be safely isolated and quarantined if need be in a way that protects the entire community. I don't know if you want to add to that.
Just to say that there's an emergency operations center in the north that since January, Northern Health Authority, the First Nations Health Authority, have been fully integrated in our planning. As you saw yesterday, you saw that in the presentations, the longer presentations we made, that we're ensuring we have, for example, identified 72 ventilators, the 15 that we've brought in and the others that we're refurbishing that are intended to fill gaps should they exist in places. So all of that work is being done now, and the North is a key priority area for that, because even though we've identified, I think, 12 cases in Northern Health today, and there are 2 in acute care, we know the importance of doing that in every part of British Columbia, and every single health authority in the Northern Health Authority is fully integrated into that strategy, because it's very important for people to have confidence everywhere in the province that we're going to be providing the supports and care that they need. Dr. Henry has shown some of the examples of that, but clearly the North is an important area of priority for us, and we're working with Northern communities, but especially through the Northern Health Authority, to see that that happen. And so you're seeing that, and you'll continue to see that in the days that come.
Last question today comes from Nick Johansson at Castanet. Go ahead, Nick.
Hi, Minister. You said yesterday you'd be releasing the list of the 17 primary care site locations. Can you point to where that's been published? And if not, can you tell me where they are in the Interior Health Region?
Did I just wanted to make another comment, sort of more apropos to the last question, in that, you know, one of the things that is so incredibly important, we keep talking about our physical distancing, but my other plea is to communities in the North, more remote communities, First Nation communities, the importance of not coming together physically right now. And it is a challenge, I know, when ceremony is so important in our lives, especially when we're in a time of crisis and a time of concern. But it is also incredibly important that we protect our elders and our seniors. And the best way to do that is to have ceremony virtually and to connect with people and support them in a way that doesn't endanger those who are most vulnerable. And that's just, I know that this is a very challenging time for many people, and I'm just appealing to you to please understand how important it is to protect our elders and our seniors in our communities, and particularly in our remote communities, because this virus can be really devastating if we're not that careful.
And I believe that information is available, but I'll find out. We'll make sure that everyone has access to the 17 sites. All of the other sites, of course, are integrated into that strategy as well. And I wanted to just reinforce in closing here that we need 100% adherence, 100% of people following the orders of Dr. Henry, the advice of Dr. Henry as well, in every community in BC, regardless of where you are, regardless of how many cases are currently in your health authority, all of that. We need people to be 100% all in everywhere. And whether you're in the Vancouver Coastal Health Authority, where we have the most cases, the Fraser Health Authority, where we have the most cases in hospital, the Northern Health Authority, the Interior Health Authority on Vancouver Island, wherever you are, we need people to be 100% all in now. If you review what we presented to you yesterday, all of it is dependent on all of you, and we want to make sure that everyone is committed to this everywhere in BC. It's vitally important we do that now, and if we can leave you with that message, it's that for 100% of people to consider this important to them 100% of the time, to the ones they love, to the ones they care for, to healthcare workers, to your communities, to the whole of British Columbia. Thank you very much. Thank you for your questions today, and we'll see you from here at 1:30 on Monday afternoon.
Thank you.